This is Lubna Allam, and I'm the secretary of the Explosive Ordnance Risk Education Advisory Group. So, for those who join us for the first time, the EORE Hour webinar series is an initiative that has been ongoing for almost 4 years now. The webinars take place the last Wednesday of every month, and each EORE Hour webinar, we have a speaker that presents on themes and topics that contribute to the enhancement of EORE. We have had over 15 webinars since the start of the series, where EORE and related field experts and professionals from around the world present on their projects, on their expertise, on innovations, and they exchange knowledge. And throughout this platform, we want that the EORE community stays up to date with the latest knowledge, tools, and ideas in the sector that shape the present and the future of risk education. So for those who would like to review past webinars, I'm going to send you the links in the chat to our EORE AG YouTube channel. And I'll share with you also other key links to the AG website, for example. So this year we have monthly webinars planned for you till the end of this year. So we have all our slots filled until November. So if you yourself wish to host a webinar with us next year, please get in touch with me via email, and I'm going to also share with you my email in the chat. Um, Before we begin, I'd like to share with you that the EORE Advisory Group has recently published its progress report, and I'll share with you the link also in the chat. The report reviews the advisory group's work for over the past 2 years and provides an overview of the EORE sector progress, and it draws upon convention reports, different AG documentations, and two EORE stakeholder survey that we conducted in 2023 and in 2024. Uh, this report also captures insights from over 250 EORE practitioners, national authorities, donors, and partners worldwide. The report, as you will see, is quite comprehensive, but even a quick skim, a quick look will give you an overview and an insight of achievements and the EORE sector trends. So I'm sharing with you this report with the EORE, our crowd, because this report is actually an important resource for EORE professionals, and it highlights how collective efforts are advancing in integration and the visibility of EORE worldwide. And at the same time, it also highlights the continuing challenges, in particular in resource mobilization, national ownership, and adapting to different emerging risks. This makes today's conversation especially relevant as we continue to strengthen inclusive approaches. So our session today will take us into an important and timely discussion on inclusive conflict preparedness and prevention and explosive ordnance risk education, reaching to persons with disability and harnessing AI for impact. So we're going to explore together in depth UNICEF's practical strategies to ensure that both CPP and EORE effectively reach persons with disabilities. These strategies have been applied in challenging contexts, just as Yemen, State of Palestine, and Ethiopia. In addition, we will also reflect a little bit on the innovative use of AI in enhancing accessibility. So I'm delighted to introduce our speaker today, Kristel Juriloo, a program specialist for disability inclusion field support at UNICEF. And Kristel brings us extensive experience in promoting inclusive approaches across humanitarian and development contexts, and we are happy to have her insights today. So today's webinar is going to be for 1 hour, and it's going to be followed by 15 minutes networking circle to give you a chance to make connections with each other and with other risk education professionals. So I hope that you're going to be able to stay for this part as well. Just before we start, a few final logistical notes that we kindly ask you to keep your mics muted during presentations. When we open the floor for interventions, kindly please raise your hand and I'm going to unmute your mic. And in case of any technical issues, please contact me, send me a message. And before handing over to Kristel, just a quick reminder to feel free to use the chat to share your questions and reflections throughout the presentation. And we will have time to address specific questions during the question and answer segment after the presentation. So with that, Kristel, the floor is yours. Thank you very much.
Thank you so much, Lubna. Hello, everyone. Very nice to meet all of you. As Lubna introduced, I'm Kristel Juriloo. I am currently working with UNICEF as a program specialist on children with disabilities. And just a disclaimer that I'm not an expert on mine action or on Explosive Ordnance Risk Education or on CPP. The fact that I had to write down what this acronym stands for is a testament to this. I studied law, and I remember when I was studying law and in the humanitarian law, I had the opportunity to provide some legal aid, legal assistance to persons with disabilities. This is actually how I started working in the field of disability inclusion. And at the time I was working with the Norwegian Welfare Administration, and we had many refugees and asylum seekers with different disabilities, and very many of them coming from war-torn countries who had actually been injured by explosive ordnance and had acquired permanent disabilities because of this. And I remember how difficult it was for these refugees and asylum seekers to access information, not only because they were new to the country, but in general on access to information for persons who are in a marginalized situation is difficult. And the inaccessibility of the environment is an issue, as well as stigma, negative attitudes, maybe not that visible, but the invisible biases that exist, for example, among employers, were big hurdles for these persons to be able to integrate into society. So when I understood that there are so many limitations in access to actually enjoy the rights that you have and access to information about what rights you have, I got into the field of working in disability inclusion. So myself, I've worked with organizations of persons with disabilities, and now with UNICEF for almost 9 years. And most of my work has been in the development field, but for the past almost 2 years, I've been working in humanitarian assistance. So I have been deployed to support integrating disability inclusion interventions for persons with disabilities in emergency response. I was in Ethiopia recently, also in Yemen and in Palestine. And I will share some examples from these countries. And before we start, I would like to just make a note about victim assistance, because I know many of you on this call have maybe been working in the field of disability inclusion when it comes to victim assistance, providing access to rehabilitation, medical services, assistive devices like wheelchairs for those who have been injured by explosive ordnance. But today we're focusing on the safety information that is provided to the whole affected population. And why I want to make this point is that I can see the connection here between what we do in preparedness, what we do in the development space, and what we are able to do when an emergency situation occurs. So if we have been in the preparedness phase, working to support governments to put systems in place, to have services in place, support assistive devices at hand to be able to deliver those when an emergency situation occurs, then we're of course, obviously, much faster, and we're able to help the whole part of the affected population. I will start sharing my screen now. And I hope everyone can hear my audio well. And please let me know if there's any issues with the bandwidth, and I can turn off my video as well.
Yes, all is clear.
Yes, great. Thank you so much. So the title for this presentation, I articulated it as people-centered conflict preparedness and prevention and explosive ordnance risk education. So I haven't focused it on disability inclusion or on persons with disabilities, but of course that will be the topic that we discuss. But I just want to make this point that when we talk about disability inclusion in general, we should try not to see it as a separate stream of work that requires dedicated capacity, dedicated resources, or view it as kind of a niche stream of work. It really is a central part of what we do. So when we are reaching affected populations, we want to reach all of them. And of course, we want to reach those who are most marginalized, vulnerable, and left behind. And throughout the presentation, I have just a couple of slides with very little text on them, really. So I will try to speak more than what you will see is presented on the slides. And then I have some illustrative photos. I think the only photo that is not illustrative I have is from Yemen, from the Explosive Ordnance Risk Education there. So quickly for the agenda. Lubna already went through this. I will share with you some examples from UNICEF's work in Yemen, in Palestine, and Ethiopia. And I believe also I have some colleagues with me from these offices online. I'm really grateful for their participation, whoever was able to participate. And of course, I mean, had to say the honor for the how we're able to reach children with disabilities in these countries through our programs goes to them, and I hope they will be able to answer any specific questions on the programs that I am not able to answer. And then I will summarize, we will summarize hopefully together the key points on disability inclusion in explosive ordnance risk education and conflict prevention and preparedness before we try to have some time to discuss artificial intelligence and how it can help us to perhaps be quicker, more efficient, save time, save money, but of course also as at the same time bearing in mind the risks that AI also poses in the humanitarian sector. First, I was hoping to have a quick reflection exercise, and I know Lubna will be there to support if there's anyone who has any points that they want to make through the chat, because I'm not able to see the chat on my side. I only have one screen, unfortunately. But it would be also great if anyone wants to raise their hand and come in, and we'll see. We will take maybe 1, 2, 3 hands in interest of time. So I wanted to ask you to reflect whether the affected population has a right to access safety information to manage risks. Do they have a right to this, or is it something that is a privilege? Do they have a right, and where does this right derive from? And whose obligation is it then to make sure that this right is really enforced? And also, it would be great if you can reflect on whether the affected population has a right to have the information that is provided to them about how to manage risks adapted to their communication needs. You know, how far do those who have an obligation to ensure this right? How far should they go to really make sure that everyone has access to this information? And then what could be the consequences if safety information is not provided in a way that is, you know, adapted to everyone's different ways of communicating? What could happen if we're not able to provide this information to everyone? Any hands up or anything shared in the chat? I mean, these are a bit of a trick questions. But there are no wrong answers. This is just, you know, to get our thinking going, so we can set a bit of a context when we dive right into the practical examples from our country level work.
Yeah, I can see Karina. I'll unmute. Yes.
Hello. Hi. So yeah, with regards to the questions, I do think that the affected populations have the right to access information, especially in a format that they can understand it. And yeah, and the consequences, what are the consequences if EORE CPP is not provided in a way that's accessible? We're talking of lives being at risk. We're talking of people. You already mentioned examples where people have become permanently disabled for exposure to explosive ordnance. But yeah, it's we all have the same rights regardless of disability. Thank you.
Thank you so much, Karina. Thank you for being the brave one to raise your hands and come in. Thank you. Yes. I mean, obviously, everyone who is part of the affected population has a right to access safety information. And we know that there are individuals who might be more at risk. For example, I mean, many of you have also been in places where you might have seen persons with disabilities, with, for example, mobility disabilities, not having access to assistive devices, not having, for example, access to a wheelchair, then having to basically crawl on the ground to go to places like to go to the latrine. So you are much more exposed to the environment if you are closer to the ground like this. So, you know, inaccessibility of the environment, limited access to assistive devices, all these things, they can actually create increased risks for those with disabilities. And same with I think of children, for example. I've seen also children go to school who are blind, who would not see warning signs that are on the streets, or children who are deaf, who have hearing loss. They will not hear if there are any warning messages that are provided, you know, orally. So this is an important acknowledgement that we need to take into account, that many persons with disabilities will actually be more at risk of coming into contact with explosive ordnance because of many of the barriers that exist in their environment. And for the second bullet point here on the right to have access to information adapted to your communication needs. Yes, of course, as Karina was saying, and everyone has the right to have the information adapted so that they are able to understand. I mean, we are there to provide explosive ordnance risk education to ensure that everyone understands how they can manage risks. And we need to think about who is part of the affected population. Of course, we know with the part of the affected population, we will have children who are maybe not going to school. We will maybe have women who are mostly at home and not accessing information that is provided outside of the home. We also have persons with disabilities. We have older persons who might not be going so much out of the household. So there are many different persons as part of the affected population. And we, as actors, we need to think about this when we're providing information and really making sure that we are adapting it so that everyone can understand. Low literacy also, of course, one of the points that I wanted to make. And for the consequences, yes, as I was saying, since there are many who are more at risk of coming into contact with explosive ordnance or experiencing negative situations due to conflict or other emergency contexts, they might come into harm's way because they have not been provided the information, because the information has not been adapted to them. If you think of, for example, explosive ordnance risk education, information only being provided in text format, only on in brochures, this will never be accessible for everyone, right? You will have older persons, like my grandmother, for example, who is 90 years old and almost cannot see. She will not ever be able to read a leaflet with small text information. So we need to think about different ways of providing the information, adapting it to all parts of the affected population so that everyone can have the same information and everyone can be able to manage risks, because we know that the consequences can be serious. Then let's move to the practical examples. I think I also saw some colleagues from Yemen join in here. I'm really glad that you are here. And I'm sure you are able to provide more detailed information than I am. So in Yemen, UNICEF is working with the Mine Action Center, the government body, to provide explosive ordnance risk education. We're also providing victim assistance and, of course, many other interventions to reach children with disabilities. But now zooming in on this. So with the Mine Action Center, we have also collaborated with the Deaf Association to identify persons with hearing impairments. So together with the Deaf Association and the Mine Action Center, a survey was administered to collect data on the location of persons with hearing impairments. And this was used to prioritize where adapted explosive risk education would be provided. So together with the Deaf Association and together also with young persons with hearing impairments, UNICEF was co-designing explosive ordnance messages. And they were also tested, of course, together with the association and with young persons with hearing impairments. A mass media communication campaign was implemented in 8 governorates. So these 8 governorates were chosen because of the high contamination there and also because of the number of persons with hearing impairments who were located there. So the information was provided through posters that were, like street posters, and I actually saw many of these when I was in Yemen myself. They are still there, and government offices and other places. I saw them. Information was provided on TV. There were videos with sign language interpretation, and also other means of information dissemination was used. Together with the Deaf Association, UNICEF designed a training manual on how to provide this risk education and trained young people with hearing impairments to deliver this education in person. And on the images on these 2 slides, I'm showing a picture of Hadel. I think at the time of the picture she was 16. It's a young person who is deaf, and she is using sign language to teach other girls who are deaf on how to be safe and detect explosive ordnance. And on the walls of the classroom where the girls are sitting, you can also see some of the posters that UNICEF and the Deaf Association co-designed. Moving on, and I don't know if there were any questions. No. So moving to Palestine, I think also I had some colleagues from both Jerusalem and Gaza joining. Thank you so much for that. For Palestine, when I was there last year, and of course many developments have taken place since then. When I was there last year, I worked together with Humanity and Inclusion, or formerly Handicap International, as well as the working group that consisted of all of the EORE actors, to develop a very simple checklist on how to provide this information in an inclusive and accessible way. And I remember that we were really acknowledging the need to integrate this guidance and this information into existing materials. So we included this very, very simple checklist into the existing guidance that was an existing training that was provided to the actors. So this going back to what I said in the beginning, that we really need to think about how we reach all parts of the affected population, how we work in a people-centered way, and integrating different ways of communicating and reaching different parts of the population into our existing work. So not seeing disability inclusion and accessibility as a separate ad hoc stream of work. So we had this very simple checklist, and I just wanted to read you the 3 bullet points from how we had recommended that EORE actors provide information through radio, how to do that in an inclusive and accessible way. Maybe you can, when I'm reading them out, you can already notice that this is really just about clear communication for everyone. So the point here is that thinking about inclusion, thinking about accessibility, reaching everyone is really good for all parts of the population. It's necessary for some people. It's necessary, for example, for persons with disabilities, but it's also good for those with low literacy and other parts of the population. So accessibility really leads to good communication in general. So for the radio messaging checklist, we had noted down that actors should provide detailed description to help visualization. So if you are describing how explosive ordnance look like, or where they are, how to keep safe, how, I don't know, warning signs would look like. I don't know, sometimes there are different ways to give this warning, right? Someone would put like colorful ribbons or so on trees. If you're providing visualized information, be as detailed as you can, because this helps in understanding. And second, use simple and clear direct language. So, you know, avoiding technical jargon and all this, as simple and clear as you can be is always the best. And this is good for everyone, as I said. And lastly, minimizing background noise. So when we have information that is provided on radio or on speakerphones, you know, any kind of oral information, really try to minimize background noise. This is important for those who are deaf, who have hearing impairments, because background noise, it can be very, very disturbing, but it's good also for everyone. So you can maybe hear the point that I'm trying to make, that when we are recommending partners to ensure inclusion and accessibility, we are making our general work better. So the checklist that we made, we didn't only have bullet points for radio, but also for other types of methods of communication, like also written materials and social media messaging and so on. We included this in the existing guidance that went out to actors. I remember this was a long guidance. It was included there as part of the guidance to actors, and we had webinars to build capacity. presenting this checklist, presenting some examples that we knew of. I think only the Yemen example was the one that we had. And of course, there was actually a WhatsApp group, I remember, with the EORE actors. So we've tried to share this checklist there, just, finding different ways to reach everyone. Because, of course, I mean, we know with Gaza, connectivity is an issue, and webinars will not always be accessible for everyone. And together with the colleagues, who I think might be also present here, we're trying to work out and continuing, I think, to work out if there are other opportunities where we can strengthen the way that we work to make it more inclusive and accessible, to adapt materials, really making sure that if we are providing any kind of information, that we do it in different formats. So we would never provide information only on radio or only through speakerphones or only through leaflets. But as long as we think of using all the methods possible, we will be reaching more people. And last, of course, disability disaggregated data collection also is an issue, and something that I know that the office is looking at, how we can work with partners to ensure that any data that is collected on how many persons we are reaching, that we try to collect as accurate disability data as possible. And I will come back to this also when we speak now about Ethiopia. I think we're doing well on time, yes. So for Ethiopia, the office has targets to, I hope you cannot hear the background noise too much. The office has, actually through all of their partnership agreements, UNICEF Ethiopia office has targets to reach at least 10 persons of the beneficiaries. 10 persons of the beneficiaries should be persons with disabilities. And the same applies for the partners who provide explosive ordnance risk education. And maybe a question to you here. If you want to come in or write in the chat, why do you think 10% is the target? And should it be higher or lower? Yeah, I'm not able to check the chat. So 10%, the global estimate of how many children have a disability is 10%. We know that in most conflict-affected areas, the number of children with disabilities is higher. The number of adults with disabilities is also usually higher than what the global estimate is. For adults, the global estimate is 15%, but for children, 10%. So this is why the office has put a target to make sure that when we are providing, when we are reaching children, that 10% of those should be children with disabilities. For Ethiopia, we held capacity building webinars for all of the regions that are affected by conflict, bringing together not only UNICEF, but also partners, cluster partners, and government partners. And we shared some practical examples of how to reach those with disabilities. And our discussion really revolved quite a lot around data collection. How exactly do we collect data on persons with disabilities? How do we adapt materials, especially when we don't have funding? And how to reach those who are not in school. I mean, for example, in Amhara region in Ethiopia, there are, I think, over 4 million children in general who are out of school. So we cannot simply rely on providing explosive ordnance risk education in schools. There were some opportunities that were identified to continue to explore. One is, of course, to collaborate with organizations of persons with disabilities. So, for example, looking back at the example that I shared from Yemen, really working with the local deaf association, UNICEF was able to identify where persons who are deaf are, how many there are, and also how to reach them, and how to adapt materials to provide information that will be understandable. So collaborating with our OPDs, organizations of persons with disabilities, is key. And the second, actually, which is a really good one that I haven't heard any actor work on earlier, is to collaborate with teachers who are specialized in whatever we call them, special needs education teachers. Teachers who are specialized in providing support to children with different types of disabilities. They can be a very good collaborator, not only when it comes to adapting materials and providing the information in a way so all children will understand, but also to mobilize communities and to reach those who are not in school. And lastly, adjusting data collection tools. So I know that for many actors, and this is completely understandable, that we rely mostly on observation of disability. So if you would have an in-person session, you would have some forms and you would maybe note down how many attended, and you can see who is a man, who is a woman, a child, a boy, a girl. And usually we also rely on observation to note down if there were any persons, children with disabilities. But I think most of us know that observation is not a reliable way of collecting data on disability. And I don't know if anyone wants to come in. Yes, Karina, I see that you have your hand up. Do you want to come in?
Yes, thank you. I've just made a couple of points. So when delivering EORE to persons with disabilities, or even when collecting data, I think it's really important, where possible, to pair it up with advocacy. In a lot of places, disability is something that's comes with a lot of stigma attached. And speaking from experience of working in this sector in Zimbabwe, for example, it is associated with witchcraft, and persons with disabilities will be kept away, even locked away in the houses. So so we really want to try and utilize, even if we do an EORE, to have a section of advocacy, so that we can be also breaking down those barriers in a community. And another point that I noted is that, again, when we are reaching out to persons with disabilities, or in any manner, we need to be very careful, because when we ask for how many people with disabilities are in the community, we creating an appetite for the service provision. So we need to come prepared, where we can actually refer those when people do come forward. And often it's a big deal for someone with disability to come into contact with someone who is discussing this with them, and we need to be prepared to be able to refer them to someone. Otherwise, it can be very disappointing, or even sometimes embarrassing for them. So I think we need to think of this holistic approach of how we go about working with people with disabilities. Thank you.
Yes, thank you. Thank you so much for raising this. I'm glad that you did. And yes, absolutely. It is an issue that, and this is also something that we discussed with Ethiopia when we were discussing about data collection tools, how exactly we can do more than just, rely on observation, because it is a sensitive issue. And it is an issue that there is a lot of stigma connected to it. And yes, as you said, there are many families who would hide family members with disabilities, and many persons with disabilities themselves who would want to hide it. So this is something to think about. If you want to collect accurate data on how many you are reaching, maybe there's a way to do it. Depending on the context, of course, a way to do it that still protects privacy, and not asking the question about whether someone has a disability or not. So the word disability has a lot of stigma connected to it. And this is exactly why, as many of you know, I'm sure, why we recommend use of questions related to functioning. So most of you have heard of the Washington Group question sets. And at the end, I have some links to resources that you can look at, because UNICEF has just worked with the Washington Group to launch a humanitarian version of the child functioning module. So we have specific questions that are asked to adults, and then we have some questions that are asked to different age groups of children. And these are all about functioning. You never ask the question about disability, because if you ask that, then you have all the stigma issues coming up, and many would not, even acknowledge having a disability or having a family member with a disability. But if you ask questions about if you have difficulties with walking, if you have difficulties with seeing, hearing, you will get completely different answers. So there's a lot we can do in terms of getting around the issue of stigma when it comes to asking the right questions using the internationally recognized data collection tools. And of course, as you said, Karina, to try to work with the communities to address stigma and discrimination. Like you said, I mean, there are many who would not seek out services. And I've been to places where I've been told that families who have children with disabilities, they do not assume that a service that is for the whole community is also for them, unless they're explicitly told that, yes, this is also for those who have disabilities. So there's quite a lot of, I think, proactive outreach that is necessary to do to make sure that we also reach those who are very often hidden at home. And as I put here, collaborating with organizations of persons with disabilities who have connections in the community, who have trust in the community, who know how to deal with the issues of stigma is really key, and can make or break when it comes to if we are able to reach those who might be confined to their homes. Sorry, Nibras, I saw that you have your hand up. Do you want to come in?
Hello. Hi. Hi everyone. My name is Nibras Youssef. I'm child protection specialist with Ethiopia. Unfortunately, I didn't have the time, and I think I was on leave maybe when you visited Ethiopia, so I didn't have the chance to meet you. I think one point I wanted to make is also that about the capacity that we have. Sometimes identification also is accessible, and it's easy to make, but also how to identify the needs of this group, and do we have the capacity even to respond to their needs, or it's just who identify them, because sometimes you just open the door, let's say, for all their needs by asking question, etc. But do we have the capacity to respond to all that? That's also one of the issues we face in Ethiopia, especially with our partners. They will be able to identify the children, but they will not be able to go to the details of what exactly the need is. And even if they are able to, there is no let's say adequate capacity to respond to their needs. And as we know, people with disability sometimes also can be expensive to provide let's say adequate service for them. And just a comment, maybe even if we have the standard international question, I would say also still testing them, and based on the context, to be tailored on the understanding and the language, etc. For example, Ethiopia itself have 7-8 regions, and I think there's around 80 languages that's are used. So this is also something that we really always have to keep in mind. Thank you. Over.
Yes, thank you. Thank you so much for coming in. Good that you raised this issue of capacity. It brings me back to Karina's point that I didn't address yet about creating expectations. And obviously, yes, when you start asking questions about either disability or about functioning difficulties, you might be creating expectation, and that is a dilemma that we need to somehow manage. And we have to think about, are we collecting data just for the purpose of collecting data, to know with how many women and men we are reaching, how many children, how many of those with disabilities, and really making it clear when we are asking these questions that we are collecting data for the purpose of collecting data to know who we are reaching, and to know also if we are not reaching someone, to make that clear, that when we are collecting data, that we might not be able to respond to all of the needs that persons have. And I am glad that you raised this point, because it's something that to think about as EORE actors, also in the wider cluster system, really, to have some form of a referral mechanism. Because if we start collecting, using the accurate tools to collect disability data, we are collecting data that could be used by other actors. We have to have some form of, mechanisms to share data, to share any kind of needs that we identify with other actors. And also, and obviously there will be needs that cannot be met. I mean, in every situation, everywhere, there are needs that will not be met. And we can use this information to try to mobilize resources, to document the level of unmet needs, either it be for the other stakeholders, for the government, but data can be used for different purposes. But as you, both of you said, it's important to make it clear for those we are collecting data from, those we are asking these questions from, to make it clear what exactly they can expect when we are asking these questions. And see now, hands are popping up. Thank you. I see, I think Abdullah was first there from, hello Abdullah, from Yemen.
Thank you so much. And I'd like to use this opportunity firstly to thank you, Kristel. You have done a great job, and it's really appreciated. It's really important to know, with your support and also for our section management, our Chief William and Hussein, we've been able to present our case to the globe. It's really important because we were implementing since 2019, and we haven't been able to share this experience to the wider community. And this happened with your support and also with William's support along with Hussein. So thank you so much. This is really appreciated. The second point which you highlighted, in such certain contexts like Yemen, data is really challenged. Looking for data is one of the real challenging. Even if you'd like to write a proposal or to write a report, whatever you are doing, you face the issue of data. But this has not stopped the colleagues and also the association to start this initiative, because we were thinking at the beginning in 2019 and 20, we were thinking about how many deaf people are around the country, where to focus, etc. So we relied on the information provided by the association, and we start the process. And this is, I mean, it's really important to have the data, but it should not keep you stopping from doing things. I mean, we can do. And through this process, we've been able to reach thousands of people with deaf disability. I mean, it's really important. But also by saying so, that's not like minimizing or saying data is not important. It's the most important in the development and the humanitarian perspective. But for certain contexts like Yemen, for example, we didn't make it like stopping our initiative. We continued the initiative, and we succeeded somehow in reducing all reported casualties among the deaf communities. I mean, which is really an added value to using this. And by saying so, this also highlighting the importance of the partnership between, let's say, the government and also the NGOs working with disabilities. What you call it, OBD. I mean, it's like, I mean, it's really important. Having a smooth coordination and collaboration between both agencies has helped also implementing this initiative. Focusing on the most important affected governorate is really essential, because we are not scattered our efforts here and there. It was really focused on the communities have deaf persons, and so that it was really straightforward to the main affected population. That's also helped. Anyway, we are here, and we would it will be our pleasure to share our experience with anyone is interested, and would like also to thank Kristel again, and also, by the way, thank Lubna for her great effort making the EORE life even healthy every month. And every month we have a new topic. So thank you, Lubna, and thank you, everyone. Thank you to William and Hussein for their support over this initiative, and thank you, everyone. And that's from my side, and over.
Thank you so much, Abdullah. I'm glad you raised this point, the connection between. I mean, we don't know how to establish the causal link between the adapted materials and the specific communication campaign that has been provided in Yemen towards those with hearing impairments, and the fact that there are actually no more casualties among this population. But as I mentioned, I mean, there is an increased risk for persons with disabilities, especially when they're not able to access information. And if you provide adapted information, you will be contributing, at least, if not completely, reducing the risk of injury. So thank you for sharing that. There are many points that I want to actually respond to. And one from Nibras from Ethiopia about adapting the questions that we ask about disability, thinking about the translation and how many questions to ask. And I know that there are some questions that maybe are not so, how to say, it's difficult to even translate into different languages. And this is absolutely something to bear in mind. So why are we collecting data? I mean, we are not doing a national survey that has to be accurate. We have to use all the questions on functioning. We have to think what kind of questions to ask. Based on what we are going to use the information for. So if we are collecting this data, we are collecting it because we are using it for this. So I like that you shared this point. And as long as we go beyond asking just if you have a disability or not, or just observing if someone looking as if someone has a disability or not, we are already doing much more than before. And again, lastly, going back to the point that was made about raising expectations and, our capacity being limited really to address all needs that come up. Again, going back to the point that I made about have some form of referral mechanism, and also to use this data to try to mobilize resources and at least document the significance of the unmet needs. And I know that for all of the examples from all of the countries that I've shared and other countries where we are providing explosive ordnance risk education and victim assistance, that the needs are always much greater than what we are able to respond to. Sorry, Bikram, I kept you hanging. Bikram from Palestine office, please, do you want to come in? You're still on mute.
Yeah. So first of all, I will apologize that people writing PWD, CWD in the group. So that is one of those things needs to be avoided in any kind of communication related to children and adults with disability, which is not appreciated by any international organizations of people with disabilities, because they say we are individuals, we are human beings, you cannot use our abbreviation for that. So apologize for that. I'm not trying to tell anyone, but it's a common practice. We should not use in kind of abbreviation here. Second thing, I second you about referrals. I was in Afghanistan and Iraq. What we used to do, we have to have a resource list of resources within the area. So when the when the risk educators, they go to the community or the individuals to go to risk education, they at least have those minimum resource list with them. They can refer to those places whenever there is need. That was the most important thing. We need to do that. Second thing, what I worked well in Afghanistan and particularly in Iraq, I'm not talking about UNICEF because I've not been to Gaza, so I have not much idea. But in Afghanistan and Iraq, they used to have a family level kind of risk education and community level of training of trainers like community volunteers, and using most very simple placards with minimum writings and all with more pictures, which worked very well for people with disabilities there. Then when we talk about, this is all about risk education. When we talk about preparedness, it goes much beyond that. There is need for mapping of resources, mapping of safe route, mapping of vulnerable areas, mapping of safe locations, and training those people, including people with disability, are more important in that case. That is what I wanted to say. Thank you very much.
Thank you so much, Bikram. Nice to hear from you. I'm seeing that, okay. I'm glad that we have active participation, but I think I have not been able to manage my time very well to come to the discussion on AI. But let's wrap up this, and then Lubna, perhaps the discussion on AI, I can share one point, 1 minute, but perhaps that's something that we can discuss whether there's appetite to have a specific webinar on. But yes, so first to wrap up on what we are talking about when it comes to disability inclusion into explosive ordnance risk education and conflict preparedness and prevention. I will just put the points out here instead of asking you to share because of the time. So the 3 key points that I want to make here is, first of all, the importance of collaborating with organizations of persons with disabilities. So from the examples you have shared, from a couple of colleagues who have spoken, when we are working with local organizations, organizations of persons with disabilities who are also part of the affected population, who are representing a large part of the affected population, we are able to really mobilize many more in the communities, and they have connections in the community, and they will be able to know where people are located and how to work with the issue of stigma against disability also. Second, data, we have spoken about a lot. It's always a topic that comes up. Collecting disability disaggregated data. We want to monitor our progress, right? We want to know if we are reaching those with disabilities, and if we are not, we should do something about it. But first of all, we need to collect data to know if we are reaching them or not. And for that, we need to ask the right questions, or at least more questions than only about disability, and to collect data in another way than only observing. And lastly, I've tried to share a little bit about the work that we have been doing in different countries in providing explosive ordnance risk education in different ways, different formats, as long as we think about using different methodologies, not only visual or audio, we are able to reach a larger part of the population. So I know, okay, now we are on time, Lubna, and I don't want to rush this topic. So this is something maybe we can discuss bilaterally if there's appetite to discuss. But I wanted to show you something. Let me stop sharing this and share my screen. So I have been recently trying to figure a little bit out different AI tools and how to there we go, and how to make them work for us, to try to save time, for example. And one task that I was working on was to review humanitarian needs and response plans, which are large documents, and there are many of them, and really looking at how disability inclusion is addressed there. And there are ways of using AI tools. I mean, there are many tools, but yeah, OpenAI's ChatGPT is one of them. to analyze documents or summarize documents. I mean, I'm sure most of you have tried these tools before. But I know that in the sector, we're still, trying to figure out how we can use them in a way that is ethical. But I have built a custom GPT. So if you're familiar with ChatGPT, I mean, it's a large language model that basically is trained on all the information data that is on the internet, for better or worse. And it works basically as a chatbot. Most of you have used chatbots logging into banks or wherever, where you will receive answers based on training data that the chatbot has been provided. So I have created a specific chatbot that has specific knowledge on disability inclusion, and specifically in the area of EORE. So, and it is really, really simple to build a custom GPT like this. So, and this will give you much more precise answers, and answers that are based on technical knowledge in this area, much better than if you just ask ChatGPT, I mean, in a general chat. So we can discuss this maybe in the next webinar, how we use ChatGPT, other language models, or other AI tools. Of course, there are many of them to support our work. And thanks, Karina, for that. Over from my side, I have let me stop sharing my screen, and I had a question for the networking circle. I think this was also shared in the invitation to the webinar. I think the presentation will be shared, and there are links to some of key resources that I have identified. You will be able to access them and look at them, including the example from Yemen, which is documented. And for the networking circle, it would be great if you have an opportunity to discuss enablers for inclusion, how we can reach those with disabilities, and really thinking about other than funding, because we know that funding is limited and it will be more and more limited, unfortunately. Is there anything we can change about the way we work to make sure that we reach all parts of the affected population? Over.
Thank you very, very much, Kristel, for sharing your valuable insights, practical experiences, your colleagues that join us from the field. Indeed, the reflections on inclusive strategies and the role of innovation, collaboration, and inclusivity. They've given us much to think about as we try to work forward to strengthen EORE and CPP globally. So for that, I really thank you so much for the excellent contribution, and we truly appreciate your time and expertise. And I'll be, as you mentioned briefly, that we are going to speak more about the topic on AI, and how we can use it in further inclusivity and the inclusion of especially persons with disability in our next EORE hour for September. So I already see people in the chat excited about that. So I'm happy, and sure we are going to get in touch again, and I'll be communicating with all our audience soon regarding our upcoming EORE hour. So thanks again for everyone. And as we prepare to the transition into the next segment for our webinar, the networking circle, I will stop the recording.